Hello and welcome to the Newborn Toolkit webinars. Today we will be discussing planning for the right devices and how to keep them working. And if you're a French speaker, you can access the French interpretation by clicking on the button below. Next slide, please. So the purpose of the webinar series is to enable multi-country, multilingual learning for high-quality small and sick newborn care. And this is aligned with the Sustainable Development Goal 3.2 for newborn survival. In 2024, the Newborn Toolkit had close to 55,000 unique users from 190 countries and territories. We have tools available in over 15 languages with technical content available in French and linked communities of practice in both English and French. Next slide. So the focus of today's webinar is planning for the right devices and how to keep them working. And we encourage you to stay in contact with the Newborn Toolkit by signing up for our newsletter. We also have a newsletter available in French, and to connect with us on our social media channels, including LinkedIn, Facebook, Blue Sky, and Twitter or X. Next slide. And just a reminder, we're kindly requesting if you have an AI note-taking pilot to please turn that off. We will provide a recording of the webinar available on the Newborn Toolkit site following the webinar today. And we just want to share some upcoming webinars. On April 15th, we have a climate-focused webinar on fighting for a future, climate risks, reality, and responses for newborns. And on the 13th May, we have an upcoming webinar on kangaroo mother care with quality, duration, nutrition, and data that matter. Next slide. Alors, bonjour et bienvenue à tous nos participants parlant français. Si vous voulez écouter le webinaire en français, s'il vous plaît, cliquez sur le bouton de traduction affiché en bas de l'écran pour accéder à la canal française. On a aussi quelques webinaires à venir, le 15 avril, lutter pour notre avenir, risques climatiques, réalité et réponses pour les nouveau-nés, et le 13 mai, les soins maternels kangourous de qualité, durée, nutrition et données qui comptent. And we encourage everyone to please introduce themselves in the chat, saying their background and maybe where they're from today. Next slide. So without further ado, I'd like to introduce our host for today, Dr. Duna. So Dr. Duna is a dedicated pediatrician and neonatologist trained at the University of Pretoria. With experience in newborn health and prevention of mother-to-child transmission of HIV, syphilis, and hepatitis B, he has worked as a newborn health specialist with EMTCT expert at WHO Chad. And currently he operates as a freelance neonatologist consultant, providing expertise in maternal and child health programs, neonatal care, and public health interventions. So without further ado, I will pass over to Dr. Duna.
Thank you for the introduction. Good morning, good afternoon, good evening, everyone, and welcome to today's important webinar on planning for the right device and how to keep them working for newborn care. It's a pleasure to open this session where we will explore how to ensure that neonatal medical devices are not only well planned, but also properly maintained to save newborn life. As we know, newborn care is a critical area of maternal and child health. Each year, millions of newborns require life-saving medical interventions, many of which depend on specialized devices, such as oxygen, blenders, and other equipment, CPAP, and frequency ventilators. However, when the best medical device can fail if not planned, procured, maintained, and used effectively, challenges such as inadequate device selections, lack of spare parts, insufficient biomedical expertise, and gap in maintenance can compromise newborn survival. Today's webinars bring together experts from hand-on experience in device planning, costing, biomedical engineering, and preventing maintenance. Through their insight, we will discuss how to plan properly using practical and effective tools. Secondly, the role of biomedical engineering association and partnership. Thirdly, practical step to set up and using maintenance neonatal device, and we will close with the experience shared by our colleague from Sierra Leone at the national level maintenance. We encourage you to participate actively, ask questions, take note, engage with our speakers in the chat box. And at the end, according to the time, will be a Q&A. So feel free to jot down your thoughts as we go along. Additionally, we will share a short survey to gather your insight. Please take a few moments to fill it up when the link is shared. With that, let's begin with our first speaker, Alice Taras. Alice is a health economist involved in the NAS 360 program. She worked with economics evaluations, developing practical costing tools, and collaborating with government to develop investment case for newborn. She currently completing her PhD in the health economics and policy. Alice, over to you.
Thank you so much for the introduction. And to kick us off, we will go through a device planning and costing tool for small and sick newborn care. Next slide, please. Next. So why this device planning and costing tool for small and sick newborn? One, there's need for practical tools by countries to be able to estimate the additional resources to meet every newborn action plan coverage target. Second, there's limited newborn-specific inputs in the commonly used health system planning and costing tools, such as the WHO One Health. And thirdly, devices are needed for high-quality small and sick newborn care. However, their continuous functionality is questionable, as most of the devices end up in graveyard simply because the consumables and the spare parts are often forgotten during the device acquisition or budgeting. And to move faster, especially now with the budget cuts from donors, we need tools, we need mechanism for improved planning and efficiency for quality care. Next slide, please. So what is the aim of this tool? It's to provide practical, evidence-based financial planning and budgeting for devices at different levels of care, such as facility, subnational level, and national level. And the potential users could be health planners and implementers, such as the government, newborn lead, clinician, biomed. And the first version of this tool was co-designed in 2023 by a multidisciplinary team with newborn experience that include the government people, the clinician, the biomeds, health economists, among many others. Next slide. So what does the tool cover? The tool covers 4 main components. That is the word furniture and fixtures, the devices, device user training at installation, and device consumables and spare parts, which we have just added based on a new data from the 65 neonatal units implementing with NAST across 4 African countries. So basically, this tool helps identify the items for newborn care, estimates quantities, and link to the cost, which can be very useful in informing procurement list and for funding. Next slide. So the tool is open access and very adaptable. And since the launch in 2023, it has had over 750 views and it has informed investment across several countries such as Tanzania, Kenya, and Uganda. Again, thank you so much for all the inputs. We keep learning and improving so we can move faster together. Feel free to scan the QR codes to access the tool and also to access the paper, which further details the tool development. Next slide. To further improve the tool, we are asking for your input, your feedback through this short survey, and we really appreciate your response. Whether or not you have accessed the tool, feel free to share with colleagues so that you can be able to learn together. Next slide. In terms of the scope and the format, the tool can inform plug-in investment to national investment cases and health sector plan, and it is Excel-based with guidance notes for ease of use, and follows a stepwise approach with option to adapt and automate. To set up the tool for use in your context, there's need to define the use case. Are you planning at a national level, subnational, or a single facility? What is the level of newborn care? Is it level 3, level 2? Currently, the default design of the tool is for level 2. How many facilities are you planning for? Is it one? Is it multiple? And there's need to choose a planning option, whether it's default or customized. To just reflect on the default option currently built into the tool, it is based on a 40-bed neonatal unit with 10-bed high dependency for small and sick newborn, and the unit roughly admits 1,000 babies per year. So for instance, if you're planning for a unit with 3,000 admission, that implies you'll have 3 times the current estimate populated by the tool. Next slide. In the next couple of slides, we'll go through the different components of the tool, and we have different screenshots as it appears on the tool. On this slide, on the general information, we have 2. That is the README first, which provides the overview of the tool. What's the goal? How did we derive the default and the structure? And we have the device specification that outlines the device specifications and examples of device models that has based on the UNICEF NEST 360 target product profile. And this mainly guides selection and purchase of the context appropriate devices. Next slide. This is the second tab in the tool. And this basically, it's a unit data setup that helps the user to populate the data that is required to be able to guide quantification and costing of the subsequent components. To highlight, the default estimates is based on the quantification of 40-bed unit, as earlier mentioned, and a 10-bed unit for high dependency unit for small and sick newborn care, and also noting that this admits 1,000 babies per year. Next slide. This is the first component, the word furniture and fixtures. This estimates the incremental quantities. This one slide back, step 1. Back. Yes, thanks. So this basically estimates the incremental quantities and cost. It considers available, and in this context, it's more the baseline, what is available at the facility at the time of planning, and aligning available and functional so that we plan for something that works. And noting that the default items, in terms of the list of items, we have 18 items as outlined on the image there. And this was mainly adapted from the Tanzania government standards, which are similar across most of the African countries. And quantities were based on the number of rooms, looking at the different rooms in a newborn unit, the isolation, the high dependency, the step down, rooming in, and KMC. Next slide. This is the second component, the device tab. Again, similar to the furniture, it considers the baseline quantities and estimates the incremental numbers that are needed. And it comprises of 16 devices. And this is based on the WHO guides for small and sick newborn care, which is also consistent with the UNICEF guides. For instance, the UNICEF guide for India and many national policies. And the quantities were estimated from synthesizing several evidence from countries, from UNICEF, and as well as data from the 65 neonatal facilities across the 4 African countries. Just to highlight here, the unit costs are from government sources, mainly Kenya, Nigeria, and Tanzania, and that's the mean cost. And noting that all the units inputs are very editable, customized, and the user can be able to add more devices, edit the quantities, edit the cost to include other components such as the warranty. Next slide. This is the third component, installation training tab, and this estimates on-site face-to-face training of clinicians and biomeds on device use and maintenance. Noting the cost estimates mainly focuses on logistics for training and facilitation fee. Noting also no per diems is included into the default cost estimate for the other attendees. Similar to other components, it can be edited to include several components such as mentorship and to widen the scope to include a comprehensive newborn training. Next slide. This is the newly added step on device consumables and spare parts. The list comprises of 9 devices, and quantities are based on 1-year consumption as informed by the data across the 65 units. Noting the cost here is the distributor cost, simply because of lack of cost from the government systems. Next slide. Having gone through the components of the tool, so what is the output for this tool? So we have 2 outputs. One is the procurement list, and the next we'll discuss in the next slide. For the procurement list, as you can see, it basically summarizes the quantities of items planned for at different levels, and also lists the items based on the default or the customized option. Next slide. The other output is on cost dashboard. And basically here, it gives summaries of the cost of the components, noting that the total cost is setup cost, and assuming all items procured or planned for are new, and 1-year estimate of device consumables and accessories. Next slide. So in terms of the next steps, we will keep improving the tool as new data is available from WHO, from NEST 360, from others, and also plan to add component 5, which is mainly on device maintenance. And here we would like to cost the biomed workshop and also include components of preventive and corrective maintenance cost. And we also aim to have this data linked into the other existing system costing tools, such as the WHO, the list costing module. Once again, if you haven't already, feel free to scan the QR code, fill in the short survey, and help us improve the tool. Next slide. Thank you very much.
Thank you. Great presentation. Also, for those who have not the chance to scan the QR codes, we can have in the chat the link that will send you to the Google form, so you can also put your answers there. And I don't see any questions so far on the Q&A, but feel free to engage with Alice. We will going to move to our next speaker. She is from Rwanda. So for those who don't speak, who understand French, sorry, you are welcome to shift to our English channel so that you can continue to follow up with us. Francine Umutezi est ingénieure biomédicale et travaille en tant qu'analyste de l'ingénierie et de la fabrication au sein de l'administration rwandaise des aliments et des médicaments. Elle était auparavant directrice de la division des technologies médicales au Centre biomédical du Rwanda, en abrégé RBC, Elle est spécialisée dans la gestion de projets d'infrastructures et de technologies de santé, dans l'échange de données entre l'établissement de santé et dans le renforcement des systèmes de santé et oxygène. Elle est présentement présidente du conseil d'administration de l'Association rwandaise des ingénieurs biomédicaux et membre du conseil national du Rwanda, Rwanda Health Allied Professional Council. Over to you, Francine.
Merci beaucoup pour l'introduction. Merci à tout le monde d'avoir participé. Merci pour cette opportunité de pouvoir partager sur les associations et partenariats des ingénieurs biomédicaux dans le cadre de renforcer les soins de nouveau-nés. Tout d'abord, j'ai voulu expliquer un petit peu le rôle des ingénieurs biomédicaux dans la planification et la gestion des équipements. À partir de la planification jusqu'à la gestion. Alors, lorsqu'un manque quelconque, par exemple, disons, dans un hôpital, ils ont besoin d'un équipement, ils ont besoin de renforcer le service de néonatologie ou alors il y a un centre nouveau pour les nouveau-nés. Les ingénieurs sont des éléments clés dans la planification. Ils conduisent une évaluation profonde afin de bien définir les équipements nécessaires. Et de là, ils préparent aussi les spécifications pour bien établir quels sont les différents types de documents qui seront nécessaires pour un service quelconque. Ils identifient aussi le budget nécessaire et travaillent avec les dirigeants et autres et financiers pour obtenir le budget. Après cela, il y a le processus d'acquisition qui suit, ainsi que la planification pour pouvoir remplacer les équipements lorsqu'ils seront obsolètes ou alors utilisés. L'autre aspect, c'est la gestion. La gestion, c'est la plus importante parce que là, l'équipement est maintenant dans le service, il est en train d'être utilisé sur les bébés, les nouveau-nés. Il doit y avoir des ingénieurs qui sont capables de pouvoir gérer ces équipements. Donc, on a besoin de les éduquer, de les former. On a aussi besoin des ingénieurs qui sont capables d'assurer la conformité avec les normes de réglementation relatives à ces équipements. Et pendant l'utilisation, mais aussi pour bien gérer les équipements sur un long terme. Et aussi, il faut qu'ils puissent assurer la sécurité des patients pendant l'utilisation. Tout ceci ne peut se faire sans la coopération de différentes institutions à différents échelles. Monsieur Andal, est-ce que vous can you please move to the next slide? Merci. Alors, tout ceci ne peut se faire sans la coopération des différentes institutions à différentes échelles. Puis au Rwanda, on a le premier volet, ce sont les décideurs politiques, le ministère de la Santé qui met en place des stratégies politiques, des programmes politiques pour bien prendre soin de ces nouveau-nés ou alors de tous les personnes qui ont besoin de services médicaux. Dans le groupe implémentaire, on a différentes institutions, mais surtout, je voulais mettre en évidence les centres de maternité et néonatologie qui ont été érigés dans chaque district. Et ces centres, ils sont disponibles pour tous les mères, et toutes les mères qui sont enceintes. Ils accompagnent les mamans et jusqu'au moment où les bébés sont nés. Et ces centres, ils ont toujours un service dans les districts, ils ont toujours un service de soins intensifs pour les bébés. Et ça, c'est très important, surtout pour pouvoir faire une différence. Et on a été, en fait, ici, ils ont installé des programmes pour pouvoir acquérir les équipements nécessaires en coopération avec différentes institutions privées, mais aussi publiques. Mais cette a aussi fait partie des personnes qui ont donné des idées, mais qui a pu contribuer pour qu'on puisse faire des changements ici. Il y a aussi les régulateurs. Alors, moi, je travaille au Rwanda EPA. Il faut qu'on ait un mécanisme de régulation pour s'assurer de la conformité à partir de la fabrication, la distribution, l'utilisation et l'élimination des équipements médicaux. Ça, c'est très important parce que à tout moment, les équipements peuvent devenir nuisibles par rapport aux patients qui ne sont pas bien utilisés. Surtout, mais aussi non seulement les équipements, mais aussi les accessoires relatifs. Donc, il faut qu'il y ait aussi un mécanisme de régulation et aussi un système de suivi pour que ça soit, pour qu'on s'assure que les services sont bien délivrés en suivant les standards et normes établis. Alors, les ingénieurs biomédicaux, lorsqu'ils collaborent avec tout le monde, collaborer avec les décideurs de haut niveau, collaborer avec les partenaires internationaux, collaborer avec les fabricants ou alors avec les régulateurs. Ils ont besoin de formation pour pouvoir se préparer, pour pouvoir préparer les services de néonatologie et s'assurer de la sécurité des patients. Ici, je listais un peu trois points clés qui sont l'amélioration de l'accès aux soins. Lorsque un ingénieur est bien formé, il contribue à l'amélioration de l'accès aux soins afin de garantir les dispositifs et équipements médicaux pour qu'ils soient correctement entretenus, calibrés, utilisés efficacement. Il y a aussi l'avancement technologique. Lorsqu'un ingénieur est bien informé, il est capable de s'adapter, d'adapter des situations nouvelles au cours d'un traitement ou alors d'utiliser les équipements qu'il a sur place et pouvoir supporter l'équipe médicale, les informer s'il y a un fait nouveau ou alors un fait qui va aider ou pas. Alors, c'est de là qu'on a des solutions durables à long terme Ici au Rwanda, les ingénieurs ont été formés. Il y a eu l'établissement de partenariats durables avec les fabricants. Et ceci dans le sens de pouvoir les former pour qu'ils soient autodépendants. Ils ne peuvent pas l'être à 100%, mais quand même, ils peuvent l'être à un niveau où, par exemple, je suis sûre que vous vous rappelez, pendant le Covid, il y avait plus de mouvements partout. Il faut qu'un ingénieur puisse faire fonctionner un équipement ou alors qu'il ait la qualification minimale pour pouvoir euh, faire la maintenance et puis aider un patient quelconque, surtout les petits nouveaux-nés qui ont besoin de ça. Alors, je voudrais ajouter que ici, en fait, sans la volonté politique, sans la volonté politique des pays, c'est très difficile de travailler ou alors de pouvoir obtenir des équipements nécessaires dont on a besoin, surtout dans les pays du tiers-monde où il n'y a pas vraiment beaucoup de moyens. Donc, c'est très important de pouvoir établir ou alors faire comment dire, advocacy, pouvoir essayer de mettre les décideurs au courant des besoins afin de sauver les vies des mères et des bébés. Merci, je vous remercie pour le moment.
Merci beaucoup, Francine, pour ces éclaircissements sur cette présentation qui montre l'importance de la place du gouvernement, la gouvernance et aussi les institutions de régulation et comment faudra-t-il travailler ensemble afin que nous puissions avoir des équipements de qualité pour sauver des vies. Okay, so let's come back to English. So our next speaker, she is is Edith. She's a clinical trainer director of the Newborn Essential Solutions and Technology 360 Alliance. She is the registered neonatal nurse and midwife by training, and she was a pioneer developing and establishing the neonatal nurse training in Kenya. Edith, over to you, please.
Wow, thank you so much, Duna, for the introduction. And hello, everybody, and welcome to this session. My session is going to be very practical on how to set up, use, and maintain neonatal devices. Next slide. So devices are supposed to make our work easier and more efficient. This means that we cannot give away our ability to assess a baby and do the work when we have a device. The device is supposed to make our work easier, and it's supposed to help us be very accurate on how we assess the baby and how we detect the problems that the babies have. So as we have this discussion, I'd like you to have this at the back of your mind, that the device is supposed to help you do the work to help the baby. Next slide, please. So as Nest is 60, we have come up with 13 newborn product categories. And under this, we have tested and evaluated 39 technologies or devices that can help us take care of babies in our units, especially level 2 newborn units, including CPAP. So these product categories span from respiratory support, to feeding, to phototherapy, to hypoglycemia, to monitoring vitals. Most of the activities that we do in a level 2 unit. So each of the devices which is listed here, and you can use the QR code that is up there, or you can go to our website, you can be able to see the 8 steps which we take through each of these devices. And the reason why we take the devices through this is so that we can be able to make sure that the devices which we are recommending in NEST 360 to be used in the nursery, that these devices will be able to stand the environment within which we work in our units. You know, sometimes we have high humidity, sometimes our temperatures are very high, sometimes we actually prolong the use of a device for very long. We have power outages. So we put all these things into consideration and we test these devices to see will they be able to withstand the hostile environment within which we function. And also it looks at some specific neonatal needs. For example, if you want to know the blood sugar, I would like to know very, very low blood sugar. We don't want a device that will tell me cannot be detected. We want a device that will give me very low blood sugars, then it will guide me to take care of my baby better. So we have these devices, and you can have a closer look on the website, and they can actually be found at Hatch Technologies, who are a global distributor, and you will be able to get all these devices. Next slide. So I'm going to give you our experience with setting up and using and maintaining devices in 5 countries. And we're just going to share with you specific lessons we have learned on how to set up and use and make sure that these devices, they help us to focus on the baby. The first thing we have learned is we must understand the clinical problem. You have to know what your baby has so that you know which device would be best suited for this baby. So even as we use the device, our clinical skills of how to determine what this baby has and what this baby needs and which device should I use, that is very critical. And so we need to be very skilled and we need to have the knowledge on how to assess the baby. The other big lesson we've learned is you need to know your device. You need to know your device in detail so that you can be able to prepare it for use based on what the manufacturer's recommendations are. We need to be able to know the device so that we can also be able to prepare the baby properly to use the device. We need to know this so that we can also monitor the baby and also know how do we stop using the device. In a nutshell, we need to know the device so that we can know how do we marry the device and the baby. Next slide. Let me talk a little bit more about knowing your device. So all the 39 technologies that we have in NEST 360, that is currently in 65 level 2 facilities in 5 different countries, what we have done as a team is we have created generic material modules which can be used by anyone. They are very simple and they look, for example, let's say giving bubble CPAP. The module is written in such a way that if you wanted to give bubble CPAP using any device available, this module will give you a step-by-step approach on how you would do that for any of the devices that you have in your unit. We have also gone ahead and created model-specific job aids for all the 39 technologies, and we continue to create these job aids so that we are very clear on how should you actually use this device to take care of the baby. We also have user videos, which are simple, and they also, again, take us step by step. Now, if you have devices that are outside of these qualified devices, it is paramount importance that you access the user manual, because the user manual, all manufacturers, they work with clinical experts to be able to describe how you should actually use the device. So if you are buying a device, make sure you have a user manual in a language you can understand. If you're getting a donation, make sure the device you are getting, you have a manual which you can be able to understand and you can be able to use to be able to decide how do you prepare the device, how do you prepare the baby, how do you monitor the baby as you use the device, and how do you remove the baby. So it is very important that every staff who's using the device to care for the baby knows, and these resources are available. I know Toby will put the link where you can get this material. Next slide. We have training and mentorship programs which help us to be able to train staff on how to use. Francine has talked about education, and she has mentioned it a couple of times. And it is very important that we take time, whether we take people away from the unit or if we do it in the unit. Actually, training done in the unit is much better because we can actually do practice sessions on the baby. Once we are confident that we should do it. So we have training and mentorship programs to make sure that teams understand how do we set up and use the devices. Teams that are trained together work better together. And there you can see examples. We have in Kenya, our lady there, Dolphin, and we have Euclid from Malawi taking through the Ethiopian team on how to use the devices. You can see there an oxygen concentrator. How do you use it? Where do you place it? Do you place it against the wall or do you leave space? We need to be able to clearly understand that, and these issues are ironed out during training and mentorship sessions. It is one lesson, big lesson we've learned is we need to train clinical teams with biomed teams together. And so you can see Charles there taking through biomeds from Ethiopia on how to use and install and take care of the phototherapy device. So these training and mentorship programs really help teams to fully understand the device, how to set it up, how to use it, and how to maximize the device as was created by the manufacturers. Next slide. Next slide, please. The other lesson we have learned is that we have moms in the unit, and moms are actually at the center of caring for the babies. In fact, now family-centered care is a key component in newborn care. And so as part of knowing the device, we need to let our mothers have a brief idea. Many moms come and they find a baby on tubes with a machine that's making a noise, and they're wondering what's happening to my baby. We need to be able to let our moms, in using very simple language, preferably a language they can understand, so that they know, what is this device? What does it do for my baby? Why should my baby be on this device? And how long, and what's going to happen to my baby? All those information needs to be given to moms. And so there's a link there. We have a mom's orientation video, which we use, and we're going to translate it into different languages so that moms can understand how do machines help babies, and it reduces their fear and makes them better partners in care. Next slide. Just as we take care of babies, we must take care of our devices. We cannot neglect our devices. The picture you can see there, if you see the content inside that's a suction machine. And you can see the content inside that suction machine. This is content that has been here for more than a week. This has been left there, and you can see even the tubing has begun changing color because it is not taken care of. We need to take care of our devices just the same way we take care of our babies. They're supposed to help us. do the work. So each device will come with instructions on how we are supposed to clean it. So let us follow those instructions. And also they make it safe, the environment safe for you who's taking care of the baby, for the baby themselves, and also for the mothers and for everyone who is interacting with that baby. So we must make sure we fully understand how do we clean all the devices which are in our possession and in our unit. They cost a lot of money. So let us take time and prolong their end of life, because they also have an end of life. We can prolong it by proper usage. Next slide. The other lesson we have learned is doing plant preventive maintenance. This is where our biomed counterparts come in. They must come and have a look at the device, even when it is not broken. They will come, they will do specific checks every week, every month, every 3 months, and every year. We need a schedule where they come and they look at the device. How is it? Do they need to change something? Do they need to improve something? Is there a bolt they need to change? Then our devices are going to last as long as they were supposed to, or even longer. Troubleshooting, we have learned, is an important thing, especially for the first line errors that may occur. It is important that us as clinicians, we understand if the device is not coming on, what am I supposed to do? Are there things I can do so that I don't always have to call the biomed? Or before I call the biomed, what can I troubleshoot? Are there simple things that I can do to make sure that even though there's an error, maybe I can fix it and maybe let the biomed later when they come to check on the device, we say, oh, this happened. We tried to put it on. We realized the batteries were out. We changed the batteries and now it is functioning. So we need to kind of be able to troubleshoot this. I always say that I think in all our experiences with the devices, all of us kind of become biomeds to be able to troubleshoot. Next slide. And finally, we must collaborate with biomeds. Biomeds must be part of the healthcare team. We have to work with them. Why? Because they are the ones who implement the health technology management cycle. We must include them when we are making decisions on which device are we going to buy in our unit. In the planning phase, which device involve the biomed? They know things which you may not know. They know how much they cost. Alice talked about consumables. They know which ones are difficult to get consumables, which ones are easy. So we need to involve them when we are budgeting and financing, when we are assessing and selecting, during procurement, during installation. Let them be present with you. During training, let us train together as we operate. In fact, they should do rounds. That's the same way we do rounds as clinical people. They should also do round for the devices to make sure that they're safe and they maintain them. And when it comes to their end of life, we decommission them and send them to where they're supposed to go. Yes, devices do have an end of life and we need to dispose them when it is time. So those are the few lessons we have learned over the years with working with devices. And if we take care of the devices, we need to learn that we are taking care of the baby, the device is helping us, and we need to take care of the device just the same way we are taking care of the baby. So thank you. Over to you, Donna.
Awesome, great, complete presentation. We really appreciate your work with 360 in scaling up level 2 NICU, and also the job aid that you provide for CPAP in level 2. That is really helpful. And I personally like your presentation, especially with the machine, the vacuum machines. And we know that our unit in most of low middle income countries are full with sepsis, and especially nosocomial sepsis, and how we can work all together with the bioengineering to keep our unit clean and schedule the maintenance and let them work properly. So let's move to our last speaker. Dr. Magala. Magala is a health specialist with over 15 years of expertise in international development. And he also specializes in reproductive, maternal, newborn, child, and adolescent health. He is currently serving as a health specialist at UNICEF, leading the maternal, newborn, and HIV unit in Sierra Leone. Over to you, Dr. Magala.
Thank you and good afternoon, everyone from Freetown. I'm going to take you through quite briefly on the journey that Sierra Leone has taken when it comes to equipment management. And this has been a partnership led by the Ministry of Health in Sierra Leone, also working in collaboration with other key development partners. And just briefly as a background, Sierra Leone has done an excellent job when it comes to the care for small and sick newborns. And it's really a pace-setter country in the West and Central Africa region. And this is a journey that started way back in 2017 when the country set up the first level 2 facilities at 4 regional hospitals. And progressively, the country has been able to scale this up to the current 17 special care baby units, and achieving the global target of having at least 80% of the districts with 1 level 2 care facility. And it is from these special care baby units that the country was able to come up actually with an equipment management system. And as we all know, for those of us who have worked in the area of newborn care, and also as mentioned by the previous speaker, newborn care, especially level 2 and level 3, there's a lot of investment that goes into expensive equipment. And Sierra Leone started this journey from a background of unclear medical equipment management, as well as governance structure that was not clearly defined. And a very reactive approach was the common practice when it came to maintenance and repair. Next. So I'll just quickly take you through the journey that the country has taken. And this is really for program managers and directors who are working at country level and are looking to support countries in terms of putting in place systems that can then lead to ensuring that we have functional newborn equipment. So in 2017, the country had biomedical technical assistants appointed in each district, but there was lack of support, no training, no supervision, scarcity of tools. 2 years down the line, a biomedical engineer consultant was recruited to support the Directorate of Reproductive and Child Health. And 1 year later, we had training of users and technicians on the SCB equipment, which also led to development of a troubleshooting guide on the equipment that were in the SCB. Next. In 2021, it was realized that we needed something that would embed best practices in management and maintenance of medical equipment within the health system. And therefore, the Ministry of Health, together with key development partners and ourselves, developed the first national policy on management and maintenance of medical equipment, which then led to the launching of a national program on preventive maintenance and corrective maintenance, which then was tested or piloted at district level towards the end of the same year. Next. Starting in end of 2021, moving into 2022, we did support the ministry to develop a modular training for maintenance technicians. What existed at the country then was mainly technicians who focused more on the EPI cold chains. And this is what we started with, integrating them now to become like biomedical technicians. We also supported the ministry then to come up with a national standard equipment list. And this really is like this a standard, if I can put it that way, that clearly defines what can be bought into the country, the specifications of the different equipment, so that then there's standardization across board. It doesn't matter which, whether it is the government or a development partner who is procuring this equipment. This is standardized for the country. In 2022, we also had a key milestone in terms of coming up with a computerized maintenance and management system for medical equipment, which then enabled the country to move into almost real-time monitoring of this equipment, the functionality. So it is easy now to be able to monitor the downtime of equipment, to raise work orders for equipment that are non-functional or are broken down. And therefore it has supported in terms of improving the time that equipment are not functional. Next. Lastly, coming to 2023, moving on to 2025, we are now in discussions with the ministry and the University of Sierra Leone in development of a diploma curriculum for biomedical technicians. Up to now, up to this stage, the country does not have a formal training for biomedical technicians. Last year, we also did introduce a solar installation program at the special care baby units. Sierra Leone is one country that experiences erratic power supply. And with erratic power supply comes power surges that contribute to breakdown of this equipment. So out of the 17 special care baby units, 10 have now transitioned to solar energy, meaning that now this equipment can be able to operate full-time without any downtime caused by erratic power supply. And lastly, after 2 to 3 years of constant advocacy, the ministry has finally established a national biomedical unit within the Directorate of Hospitals and Referral Services. So very briefly, that is the journey that Sierra Leone has taken. And just some 4 or 5 key points that really we would want to emphasize looking, reflecting on this journey that the country has taken. Next. Next slide. Oh, before those 4 points. So this is just an example of a scorecard that we developed looking at the functionality of equipment in the special care baby units. We use some tracer equipment, those 4 tracer equipments, and at a glance you can be able to tell which hospital is in red and therefore requires immediate attention in terms of either repair or replacement of broken down equipment. Next. So what can we learn from this journey in terms of lessons, and what also other countries can use when supporting the government to set up medical equipment systems? One is the need to have in place strategy documents, guidelines, and protocols. This we have found quite useful. As it helps to standardize and to direct the systems. Second is clarification in terms of governance structures at national, district, and health facility level. And third is building the capacity of the biomedical teams at national, district, and health facility, and especially focusing more on the job training, mentorship, and coaching. And lastly is establishing a monitoring and reporting system so that at the national level, it is very easy to know what the functionality of equipment across the health facilities is. So thank you so much.
Thank you for the presentation. I think our time is up. We should maybe stop here. And I don't see any question in the Q&A. All questions have been answered directly. Feel free to engage with the presenters. We have very good sessions that was really focusing mostly on planning the right device and how to keep them working for a newborn healthcare. Very insightful presentation, convey with the key aspect of neonatal device planning, biomedical engineering partnership, and how to maintain them, and also lesson learned at national level of national program with UNICEF and Sierra Leone. Thank you, and over to you, Alison.
Thank you. The recording for the presentation will be available on the Newborn Toolkit website in the next day or so. So please check there for the recording once available. And with that, I think we'll conclude the webinar. Thank you all.